Hey guys, I am Nikisha from Canada Immigration TV. In this video I'm going to talk about highest paid nursing specialties in Canada. If you're interested in learning more about this topic, please watch this video all the way to the end. For the most recent immigration news and updates, please like and share to this video. Don't forget to subscribe to my YouTube channel by hitting the subscribe button icon of the notification bell. 1. Enterostomal therapy nurse. An enterostomal therapy, ET, nurse undergoes intensive training to treat open wounds and stomas. Stomas are openings in the body, either natural or artificial. An example of a natural stoma is the mouth or nose. Artificial stomas are put in place by a doctor or surgeon to treat various conditions. For instance, if a patient undergoes a colostomy, they will receive an opening in their colon. ET nurses treat stomas and help patients recover from them. Sometimes stomas do not heal after they are meant to, leading an ET nurse to continue treatments. They offer these treatments at facilities, hospitals, or homes as needed. ET nurses also provide education and rehabilitation to help patients get back on their feet after an ostomy procedure. Because of their extensive knowledge on the subject, ET nurses will also offer advice about potential ostomy surgeries. They might speak about where to best place a stoma, or how the procedure could affect the patient in question. They can also be in charge of planning discharge or rehabilitation steps. All this expertise helps make an ET nurse one of the highest paid nursing specialties Canada has to offer. 2. Cardiovascular nurse. A cardiovascular nurse will assist in the caring of adult cardiovascular patients. Cardiovascular refers to a condition with the heart, so many of these nurses work with patients with acute or chronic heart conditions. They also sometimes assist cardiac surgeons during heart surgery. Most often, a cardiovascular nurse works in treatment and rehabilitation after an episode such as a heart attack. They might also perform resuscitations via defibrillators if a patient goes into cardiac arrest. These nurses build their skill sets and knowledge around the cardiovascular system, using their training for assessments and monitoring to better understand their patients' issues. An example of an assessment is arrhythmia interpretation, during which a nurse might listen to a heartbeat for irregularities. An irregular heartbeat is another condition cardiovascular nurses treat. The position is highly sought after and uses extensive knowledge and skills regarding the heart. 3. Community health nurse. Unlike many nurses who work based out of hospitals, community health nurses connect with the community more directly. They can give aid from strategic locations such as health centers, schools, or even from patients' homes. Community health nurses fill a specific niche within the nursing role. Along with providing treatment, community health nurses can create health plans such as nutritional diets for their patients. As their patients encompass their community as a whole, these nurses will offer plans to the surrounding area and help implement them for an overall healthier community. Another large role for these nurses is education. Though they do treat diseases and conditions, they can also teach patients about the prevention of such issues. Sometimes issues they try to counteract are obesity, substance abuse, or sexually transmitted diseases. Due to the nature of the job, community health nursing is one of the highest paid nursing specialties Canada has, coming in close behind cardiovascular nursing. 4. Critical care pediatric nurse. A critical care pediatric nurse looks after children in need of critical care. Any child between ages 0 to 17 in serious condition needing intensive care will receive treatment by one of these nurses. These nurses can care for children with serious illnesses or those recovering from an accident or surgery. Critical care nurses provide long-term care or short-term care depending on the condition of the child. These nurses also act as the liaison between a surgeon and the family in the event of an upcoming surgery. The nurse will explain the procedure to both the patient and their family and ensure both have a good understanding of the situation. After the surgery is complete, these nurses might also discuss with the patient and family what took place and whether it was successful. Critical care pediatric nurses have extensive training to treat a variety of highly serious conditions. If a child might succumb to a specific condition, such as heart failure, these nurses will take it upon themselves to resuscitate the patient and get them into a stable condition. 5. Critical care nurse. Critical care nurses treat anyone from ages 18 and older with a serious condition. Similar to critical care pediatric nurses, critical care nurses provide either long-term or short-term care depending on the patient's need. They will also act as the go-between for the patient and their family, and a doctor or surgeon. Usually stationed in the intensive care unit or the trauma unit, a critical care nurse often looks after patients who come from the emergency or operating room. Once a patient is in a more stable condition, they will leave the emergency or operating room and remain in critical care until they recover. Patients who go through the emergency room might have a sudden, life-threatening injury or condition, such as a heart attack. Others who need the services of the operating room might travel from critical care to operating and back, depending on what their surgery is for. Others still might come from the ER and travel straight to the operating room, where they will recover from emergency surgery in critical care. 6. Emergency nurse. Emergency nurses work in high-stress situations like emergency rooms and departments. They also provide treatment for patients in ambulatory care centers and military settings, including war zones. Emergency nurses have the training to deal in any emergency, capable of assessment, diagnosis, stabilization, or even resuscitation. Trauma and life-threatening injuries or conditions need immediate care, and emergency nurses are the first available to give it. Because of this need, these nurses learn to take charge of a situation and make quick decisions. These nurses do not work in the same areas as urgent care nurses, who treat non-life-threatening scenarios. Instead, emergency nurses work to stabilize a patient until they can move to a critical care unit, or an operating room if they need immediate surgery. Don't forget to click on that notifications bell icon. See you soon in next new immigration update.